So I'm gonna make an addendum to the HVLA technique that I taught for the cervical spine. So I'm gonna go step by step with this technique and discussing what is happening at the particular segment. So to implement the HVLA technique and say that I want to gap the left side of C4 on C5, I'm gonna forward bend to that segment. And when I feel a gapping or space in between C4 and C5 spinous process, that lets me know I have achieved the ligamentous lock to that segment. So flexion to that segment introduces the ligamentous lock. Again, I want to gap the left side. So what I'm going to do is side bend to the right until I feel a gap, a space in between C4 and C5, which I do right here. So this introduces the facet lock. However, we know that with side bending to the right, an up glide has to occur. And it's the same thing with forward bending. So now that we have a facet lock with side bending right, on the left side, we have also facilitated an up glide of C4 on C5 with the facet lock and also with maintaining the forward bending. Now, as I introduce the rotation to the left, this is where we get the gapping to occur on C4 on C5. So now we have a gapping, even more space of C4 on C5 to occur. And now, once I get the patient to end range, this is about end range, I can introduce my high velocity, low amplitude thrust like so. And she did get a little release there. But it was very gentle. And so that is what we consider gapping on the left side, C4 on C5. Flex to the segment, side bend, and rotate to the left. So forward flexion, flex to C4 on C5, side bend for the facet lock. Then I'll rotate to the left. There's an opening or gapping occurring at the left of C4 on C5 in a previous video. But you will see in the literature that in the cervical spine with that technique, it's referred to as gapping, similar to what is used in the lumbar spine. My patient is lying down on her left side on a arch foam. So lying down on the left side on the arch foam introduces left side bending of the lumbar spine. So her lumbar spine is in a left side bent position. So now scoot towards me. We have a patient scoot a little bit more towards me. Good. Now what I'm going to do, I'm going to start with the lower segment first with the legs. So I'm going to flex her to the segment of L4, L5, and when it's open, so now that segment is open. Okay, so I introduce a ligamentous lock from bottom up. Now I'm going to introduce rotation, facet lock from top down, like so. Good. And come in here and just grab me right there. So again, I find with my thumb the iliac crest, I work across that, and now my middle finger is on the left transverse process of L4. Okay, so now I'm gonna place my hand here like so, and my force is gonna act downward with her knee on my thigh, and I'm gonna elongate her as I pull down like this and apply a PA to the left transverse process of L4. So as I elongate her and bring her down, she is rotating to the right. However, since I'm elongating her, there is a gapping occurring on the right side of L4 on L5. And so I elongate, and I get the release. So in this case, with the rotation of L4 on L5 to the right, a gapping is occurring on the side that's facing the ceiling. So this is your right side, right? So a gapping is occurring on the right side when I do that with the rotation to the right. We know with this technique, coming in hug me, when I perform this technique and elongate her, and then add the thrust manipulation, we do know that we get a gapping to occur on the right side, and we got approximation occurring on the left side with rotation to the right, facilitating rotation to the right of L4 on L5.